Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and thank you to this webinar for new and nearly new state ombudsman. This is Carol Scott with the National Ombudsman Resource Center, and today is February 27th, 2018. And I want to thank Mark Miller and Joe Rodriguez for joining today as kind of presenters, but also facilitators and question answers, and a couple of guys who've been doing this for many years. And I think that the information they're going to provide is going to be very helpful. Everyone is muted right now, but I will be from time to time unmuting. So feel free to just mute yourself. Do not put us on hold, though, because as much as we like your elevator music, we'll do without that. So just put yourself on hold. And if you have any questions, please just type them in the question box in the toolbox. You'll notice that there are handouts in the toolbox also. They are the same ones that were emailed to you earlier this morning. So with that, we're just going to jump right in. Again, if you have questions, feel free to type them in. But we'll also, as I said, be unmuting lines to get some conversations going. Today's webinar is on talking about the role of an ombudsman and the building of relationships, and who are the key players that you at least ought to be aware of, and they ought to be aware of you and your program. So we're going to
Carol?
Yes.
Carol, it's Mark. I'm sorry. I'm just joining by phone. I couldn't access on the web.
Okay. Well, I'm glad that you're here. So that voice is Mark Miller. So we're going to talk about some resources, and then hear from Joe and Mark, and then and from all of you, and then have a question and answer period. So I guess I'm going to unmute right now, because what I'd like to do is ask everyone, what's the biggest surprise that you've discovered in your role as the state ombudsman or the entire program? So any of you that want to speak, just jump out and say something. Don't be shy.
Carol, this is Charlotte. Can you hear me?
I can hear you.
I will say that in Arkansas, when I was a regional, I felt like the ombudsman program was well known throughout the state, and I'm finding as the state ombudsman, that's not the case, so that's kind of been surprising to me.
Okay, thank you. Anyone else? Bill, I'm going to call on you. Are you listening? Claudette? Cynthia?
Yes.
What's been the biggest surprise about your role?
That's kind of a loaded question. I think not realizing how much different each state's program is.
Okay.
It's a lot of the similarities, but there's a lot of things that are different.
That is very true, and sometimes when you're talking to people, you have to get that that groundwork. You have to kind of ask a few more questions when you hear their answer, because if you're thinking, oh, we can't do that, well, it could be because of the structure or because of where you're housed. So certainly that is a big factor. How about anybody else?
Hey, Carol, this is Margaret in Pennsylvania.
Hi, Margaret.
I think what I didn't realize was how misunderstood our role is, that we are resident directed, and it does take some time to get folks to come around to understanding that we are not like other, and at least for me, I'm within state government, so there is oftentimes I feel that I'm the only one in the room who really understands what it is we do.
Yes, and that feeling never goes away.
It's very lonely. That was surprising. Very lonely.
Yes. Thank you. Thank you, Margaret. Anybody else want to chime in?
Hi, Carolyn. Michigan.
Pardon?
Sorry, Carol. It's Sally from Michigan.
Hi, Sally.
Hi there. I wasn't sure if you could hear me or not. There might have been some feedback on the line. I think the thing that was somewhat surprising for me when I took on this role was how there's an expectation that the ombudsman, either as a state ombudsman or as a program, knows everything and can fix everything. And that was a little surprising to me, and maybe I had those expectations in the past of our former state ombudsman, but it's amazing what people expect you to know and how you are expected to be able to correct everything within some program limitations.
Boy, it's nice to feel like you're the king or queen, isn't it? Until somebody...
Without much authority.
Yes, yes. Okay, well, thank you all. We're gonna, if you'll self-mute yourself, I can leave everybody open. And if it gets too noisy, okay. Well, there we go. I just muted everybody. Okay, so thank you for that. I think I think sometimes when we come into a position, we really feel like, oh, I understand this, and I'll be able to handle all of it. And then you get into the job and you find out there's something new every day, and that may explain why we consider people to be new for at least the first 2 years, and why we continue to invite you to these webinars and to orientations when we're in person, because there's just so many different topics that you need to, if you don't know the answer, you at least need to know where to go to get the answer and who to talk to. So, and we know that people stay on past the 2 years. Many of the new people stay on for the 3rd year, and some even into their 4th year, because they just want to be kind of reminded and grounded in what the job is, and always pick up a new nugget or so. So some resources, these are the handouts that I emailed and that are on the handout part of the toolbox. There is tips from NASOP on building relationships that you might want to just skim over. There's a couple of pages from NALTCO, which is the National Association of Local Ombudsmen, and they put together several years ago what they felt at that time that local ombudsmen need from their state ombudsman, and that's always a good thing to look at. It might not be applicable, all of it, to your state, but maybe a reminder to just maybe ask them at some point, what are they needing from you, and then are you getting it to them? There is the history and role, which is part of the curriculum. I think most of us that have been around for quite a while feel that that's one of the best documents for just being grounded. And it was a document that when I was the state ombudsman in Missouri, I pulled that out and would look that over every several years, just to, again, ground myself in what was I doing, what kind of conversations was I having, and what was I passing on to the local folks. And the last resource that were sent is a webinar from 2016 that was specifically on building relationships with your program representatives. And again, that is the webinar. And if you go to the NORC website on the login side and look under New Ombudsman and then calls and webinars, you'll find the recording and all of the handouts that went along with that. And as you know, on that NORC website are all kinds of resources, and if you can't find it, don't hesitate at all to send an email to Katie or myself or Amity or Sarah Hunt, and we'll be happy to track down whatever resource you might be looking for. I want to especially point out the management highlights. This is a document that every spring at the spring conference, we ask everyone to look at their state, going down the column and making any changes that need to be made. This document was created many, many years ago for just the reason that was brought up this morning, that so many different structures, so many different program uniqueness to the different state programs, that we wanted to be able to look, and if we were in a state unit on aging and we wanted to get an answer to something, we could look on this document and pick out a couple of states to contact to say, hey, this is what's happening in my state, has this happened to you? And then it just kind of grew into, do you have the AAAs as part of your program? Do you have volunteers that visit in assisted living? Does your state also have a managed care ombudsman or a dual eligibles program ombudsman, and doing advocacy in those areas? And so that document is, again, on the login side of the webinar, and do not be embarrassed if you've forgotten your password. I swear, when I probably every 6 months had to call or contact the resource center and say, now what was my password? So hopefully you guys will be better at that than I was. But this is an incredibly rich piece of information, especially when you are looking for answers. Some touchstones. Again, we're obviously very focused on the resident and what does the resident want, and knowing the roots and the role and the responsibilities in order to not only model this for local ombudsman and all your representatives, but for other people. And then making sure that you have taken the time to look over and read the Older Americans Act, the federal regulations, your state policies, procedures, and requirements, and then whatever your certification training is, or using the certification training that is on the curriculum that's on the NORC website. And then I hope that you'll take advantage of the resources you have through Amity, Katie, myself, and Sarah Hunt, and of course taking advantage of your peers, either hopefully through NASOP, getting involved in a committee, calling in for the open membership calls, listening in on the board calls, talking to your mentor, sending in an inquiry to NORC for us to send out to everyone. I mean, the Resource Center is here to be of help to you and to your representatives. So I'm going to open this up now to Joe and Mark to talk about how they've defined the role of the long-term care ombudsman. Gentlemen? And you're now unmuted. How convenient.
Thank you. I think, from my perspective of having done this job for quite a while now, I think it's important to remember what your role really is. You're an advocate, and you really need to be the chief advocate for residents in your state. It's in our mandate, it's in our laws, it's in our regulations that you you make the voice of the resident heard. You don't need to ask for permission to speak. You don't need to ask, is it okay to do my job? This is what the law requires of each of us. And I know probably for the first half of my career, I wasn't always able to do that. There were restrictions on how much I could say and how much I could do. And it really was because of a very insightful and forward-thinking state unit director who really became my advocate and worked with our Health and Human Services Agency and our governor's office to really explain that this is the role of the state ombudsman, that I have to be free to offer my opinions and perspectives without interference. And when we updated our state enabling statute several years back, we wrote into the bill, you know, that the state ombudsman must have the freedom to do his job without interference from the state unit, any other state department, or the office of the governor. And I feel fortunate in that the people that I work with understand that. They understand that I'm not trying to be difficult, I'm not trying to be different, but this is the role that the Older Americans Act envisions for the state ombudsman. You know, I don't think about things in a vacuum. You know, I always confer with my state unit director, who's been around for a while herself, in various capacities, working for the state and in older adult programs, and I value her perspective because I don't want to think in a vacuum. I don't want to be siloed in my perspective on issues, and so I'll frequently talk to her about what does she think about this particular issue, and sometimes she points out things to me that I didn't consider or didn't know or didn't realize, and I find that to be helpful. She's a good sounding board for me. I trust and value her opinion and her experience and her perspective, and it helps me do a better job as an advocate for residents. I think it's really a great gig, you know. Not only can you have an opinion, but you can also share it. You're required to share it. You have to share it. That's what the law wants. The law wants the ombudsman to be that mouthpiece for residents, to inform the legislature, to inform other state departments about the real problems that residents have, whether it's discharge eviction, whether it's concern about quality of care, whether it's being treated in a way that denigrates the dignity of the individual when you're a task to be completed rather than a person to be cared for. We have a responsibility to make these problems known and to work on solutions for these problems. I think, you know, in trying to explain my role to others, you know, whenever we get a new legislative director at the Health and Human Services Agency, of which we're a part of, my state unit director and I usually try and make an appointment to go talk to this person to explain to the person, if she doesn't or he doesn't already know, what the role of the state ombudsman is, and not to be surprised, you know, if you see Joe at the legislature testifying on a bill. They shouldn't be surprised, because I always let my director and our agency know the positions I'm taking on bills and when I plan to advocate for a particular bill or issue at the legislature. There's no surprises. There's no lack of transparency around what I do. And certainly for controversial issues, I'm going to make sure that I let people know what position I'm taking and what I'm going to say. There's not an attempt to control the message. There's not an attempt to muzzle me. It's just a courtesy to the people I work with, so they know what I'm going to do. Again, I'm not asking for permission. I'm informing them of my position on these issues and letting them know the path I'm going to take. And it's great to have that kind of relationship with the state unit and with the broader Health and Human Services Agency. They know me now. They know, that I'm not gonna fly off and be half-cocked in my comments or testimony to the legislature. They know that I focus on facts rather than opinions, and that I can call other agencies, to do their jobs in a way that isn't rude or insulting to sister agencies that we work with. They know that this is part of my job. This is what I'm supposed to be doing, and fortunately, I have the ability to do this job. I feel fortunate in that I'm supported in my position by my state unit director and our agency and the governor's office, and it's a great gig.
Great, Joe. Thank you. Mark. Mark, you might be muted. Well, it appears that either I muted him or we've lost him. Oh, no, bummer.
I just sent him a text.
Okay. Well, I don't see him listed on here, so I don't have a way to unmute him. So, okay, well, he was going to talk about having a vision and keeping staff focused on program goals, and if we get him back on the line, we'll have him.
He's here. We just can't hear him.
Oh, okay. But he can hear us? That's scary.
Let me see.
Well, bummer. Okay, well, if we can get him on the line later, we'll have him catch up with us on that. So I want to open up the lines and ask you, what's the most challenging aspect of your role?
And the most challenging aspect that I have right now is the lack of funding for our office.
What? Who's that? Cynthia, is that you?
Yes.
Yeah, could you repeat that?
The most challenging issue that I'm facing right now has to do with lack of funding for our office.
Boy, I don't know. Joe, were you able to pick up what she said?
Yes, I think, Cynthia, you were saying your most challenging issue right now is lack of funding for your office?
Yes.
Oh, okay. Yeah, that is tough. And that's certainly something that I think a lot of programs have struggled with. Anybody else want to say what their most challenging aspect is? Sean or Susan?
Yeah, so this is Sean. I'd say toughest aspect has probably been managing time in the sense of you get pulled in a lot of directions. So sometimes it's difficult to know for sure what you should be focusing on, and maybe what things that you would like to focus on, but maybe you don't have as much time. So I guess sometimes priorities, and I guess maybe that should be clearer, but sometimes you are pulled in many different directions. So it's trying to again manage your time. And I guess that also I do feel as though like managing other people. So, I guess my previous job, I, was a staff attorney, so I could manage my cases, and I guess I, kind of depended on myself, whereas this position is different in the sense that, there's other people to consider. And that sometimes that's really good because it gives me different perspectives, but it could also be pretty challenging at times.
Absolutely. Anybody else?
This is Jenny. Can you hear me?
Yes.
You can?
I can.
Okay, well, I don't know why all of a sudden it changed, but for the first half an hour, it wouldn't work. So, goodness. All right, so I think one of the biggest challenges that I've had is kind of going along with what he said, but trying to get all of the regional ombudsmen that I work with kind of on the same page and all of us moving in the same direction. Sometimes that's been a challenge because different areas of the state kind of have different ways of doing things, or I hear, well, we've done it, we've done this for the last however many years, and so things like that, just trying to get everybody on the same page moving forward.
I think that's, I think other people might be nodding their heads right now with the coming of the new rule. It solidified some things that kind of showed that some of the programs across the country were not doing things entirely the way they should have, because there wasn't anything to say this is how it is to be done. And unfortunately, you walk into a situation where people kind of have been doing their own thing, but now that we have the new rules and it's real clear on who's in charge and who's how we do things, that's, I don't know if maybe some of your colleagues will have a good solution and pick up the phone and call you, because that's a tough one. That's a tough one. Anybody else? Well, let's see here. Bill, he can't, let me see here, Bill, are you?
Can you hear me, Carol?
I can hear you now. Yes.
Okay. For the first half of it, I haven't been able to comment. I've been trying, but it hasn't worked for me. One of the things that I was wanting to let, especially all the new state ombudsmen know, is that systems advocacy is not always conducive to good mental health, and there's battles that we fight, and sometimes we win and many times we lose, and it can become very disheartening. And one of the things that I would like to always convey to new people is that, don't give up. Find whatever outlet you can to refresh yourself. And for me, it's, getting out into a nursing home and visiting residents again. And so that's always really important. And I know that I in my state anyway, which is very red and very conservative, it is a challenge over at the legislature to even get them to listen to you, much less work with you sometimes.
Okay, thank you. Good advice. Absolutely good advice. Anybody else? And don't forget, you can always type stuff in if you're too shy to say anything, or for some reason you're not able to speak. Okay, well, we'll move on. Mark, are you with us? Oh, I bet he's just pulling his hair out. Okay, so Joe, talking about identifying key players, why don't you share your knowledge on that topic?
Sure. So, the great thing about engaging in systems advocacy is you don't have to be the lone ranger to do this, and actually, your voice becomes louder and stronger when it's joined by other advocates. So, I look to oh, I'm sorry, I'm getting a message from Mark. He says that he's muted on our end. So Carol, maybe check and see if you've got him muted.
I don't even see his name anywhere.
Oh, okay. All right.
That's the problem.
Okay. Well, I'll go on then. You don't have to be the Lone Ranger. Reach out to other advocates in your state that you share, a common interest with. We work here closely with other advocacy groups like Disability Rights California, citizen advocacy groups like California Advocates for Nursing Home Reform, Justice in Aging has a big presence here in our state, and we're able to come together to work on issues as a group of advocates. And when all of the advocates are saying the same thing, it makes for a powerful statement to the legislature or the Department of Public Health or the Department of Social Services. It's an easier lift when you've got more people involved. We're also fortunate in that we have in our state a local ombudsman association that was started with the encouragement and support of the then state ombudsman at the time, Bill Benson. They were able to advocate and speak at a time when the state ombudsman couldn't. And so, over time, they've become a powerful voice for residents as well. And it's great to have their help and assistance. If we can pack a hearing with 15 or 20 local ombudsmen in attendance, it makes the testimony and the statement even more impactful, because these are boots on the ground people who have real experience with these issues. I think it's natural, I think, for state ombudsmen to look to their locals for help. I know if there are events in our state that I can't get to, because of the size of our state and my calendar, I reach out to my locals and say, hey, can you go to this hearing down in Los Angeles? I can't make it, but I think we need to be at this hearing, and please, carry this message for me. It empowers your local staff to be a part of the vision of the office, and they can help implement that vision by speaking on behalf of the state ombudsman at informational hearings, in testimony, meetings with other state departments and other advocates. It's a good way to stretch your visibility and presence and empower your local ombudsman representatives to become involved in systems advocacy. It's good, of course, to know the other stakeholders that aren't advocates. It's good to know, the folks that work in your licensing and certification programs. It's good to know the people who work in the industry. It's good to reach out and get to know their policy people, their training people, identify opportunities where you can meet with their nursing homes and assisted living facilities, their staff, and find areas where you have some common ground. We're working on a project in California right now with Justice and Aging and our larger assisted living association and the smaller 6-bed board and care association and our office. We're looking at how we can improve the administration of medications in assisted living. Right now, residents have to be able to self-administer their meds. Staff, unless they're a licensed or registered nurse, can't administer medications. We don't have a medication technician classification in state law. And we're working together with the associations and the other advocacy groups to identify this problem and what could be some possible solutions. So I think you shouldn't have an adversarial relationship with your trade associations. Yes, there are going to be times when you disagree, when you have a difference of opinion on certain issues, but there are also opportunities to work together to resolve issues. And I think this is a great example of the advocates and the associations and others coming together to work on something in a very positive way. There's no finger pointing, there's no accusations or casting aspersions on facilities. It's recognizing that this is a problem that we have in California, and how can we work together to resolve it. I think it's good to identify those key players, those that you have a natural affinity to and with, and those where you may not always be on the same page, but still should be working together on behalf of residents.
So, Joe, I now have Mark on the line.
Great.
So Carol, can you hear me?
I can hear you, Joe. Can you hear him?
Yes, I can hear him.
Excellent.
Oh, that's great. Sorry for the confusion. I kept talking and nobody was hearing me. It's kind of like every day around here.
Yeah. So do you want to start with the first question of defining the role of the ombudsman?
Yeah, maybe I can do this in somewhat of an abbreviated fashion so I can catch back up to Joe. Obviously I consider myself to still be new, still learning, and I know Claudette made the comment about every program being different, and I think that's, after being in 3 of them, I think that's definitely true. Every program is somewhat unique, and if you've seen one ombudsman program, you've seen one ombudsman program. And to follow up on some of what Joe said, we are different, and sometimes it is a little bit uncomfortable, but people are depending upon us to be their voice, and that's not always an easy thing to do, particularly when you're working from within state government, because they're always wondering, well, why are you speaking up, or perhaps why are you taking a different perspective or a different opinion on something, and so that can be uncomfortable, and quite frankly, you're sometimes get treated as the redheaded stepchild, I think. But just to kind of add to some of what Joe said, I've actually thought about this for quite a while, and I think when you look at what we do as state ombudsman, one of the things that always comes up for me is the kind of the program development management, which seems to take most of the time, and maybe in some ways one of the most important things we do, followed by systems advocacy work and certainly outreach and education and individual advocacy, which is something I've had to get used to here in DC. It's because we're so small, I'm in the weeds on a lot of individual complaints, which I haven't been for many years, and so that's still, for me, kind of an adjustment. But I think when you look at least from my perspective, one of the most important aspects of our job is to provide some sort of direction and support to program staff and volunteers, because they're really the ones that are doing the work. They're kind of the boots on the ground, and they depend on your leadership. It's important for them to know, I think, where the program is going and how to do things. And oftentimes what I have found is particularly if you have local programs, they're all kind of operating as a loose confederacy of advocates. And one of the things that the state ombudsman really has to do, I think, is help them operate as a single program, because oftentimes they lose that perspective. They're doing their own thing at a locality, and it's important to see how their work impacts overall work of the program, and you need to kind of keep them focused on that and going in one direction, which brings me to my other point, and that is I think you need to have a vision for your program. You're in a leadership position. You need to look both short-term and long-term, and that it takes a while. It might take a couple years. I'm still trying to figure out here in DC what that long-term vision is, but I think you have to ask yourself, what puts the program in a better position to help residents, both individually and systemically? And I can give you a couple of examples. So short-term right now, we're focusing on trying to develop resident councils, real resident councils in assisted living facilities in the district. That's kind of the short-term thing. In my previous experiences, what I've done, and I'll try to do this briefly, in Virginia, when I became the state ombudsman in '92, we had what they call a balance of state structure. So we had only about 6 or maybe 8 local programs, and the rest of the state was covered by the state ombudsman. So over my time there, that long-term vision was to have local programs everywhere, because if people don't have access to you, you can't help them. In New York, when I got there, we had 45 local programs, very little money, given out. They were mainly run by the AAAs, and so they weren't devoting a lot of time to the program, and so not a lot was happening. So the long-term vision there was to, maybe reduce the number of programs, go to a regional model, and then have actual full-time staff that could, spend, every week, every day, working just on ombudsman issues. And those sorts of, you have to express that vision and you have to keep hammering out at it. But it takes a while to figure out, well, what is it that I should be doing? But those are just kind of a couple of examples. And then I think also in terms of the vision thing, keeping your staff and the locals focused on what your program goals are and keep them working in a single direction as a team. And that's not always easy to do. That's just a constant sort of thing that you're doing. So that's kind of my just overall perspective on the role.
Great.
If that helps.
Yeah, it does. That's great. And then we were talking about identifying the key players.
Yeah. So for me, it's been particularly here in the district. And again, I consider myself relatively new. I'm still trying to learn who everybody is, but I've relied on my staff to help make introductions to regulatory entities, to the provider association, and to help using them to help me identify, okay, who should I be talking with. I sat down with my staff and tried to figure out, well, okay, what are the regular meetings that we attend, coalitions with regulatory agencies, consumer groups, and that sort of thing, and kind of just have gradually made my way around to those folks. Interestingly, the first people I really got to know in the district were city council people, because it's in some ways a small town, and they're very interested in how we're serving their constituents, their older constituents, in their individual wards. And so I think that was very helpful, because it gave me a grounding in terms of what their interests were and things that I could potentially get done systemically. And so that I think was pretty important. I don't know, I think, Joe, you might have talked a little bit about the aging and disability communities, connecting with them.
Yes.
That's, traditionally that's been an uneasy relationship between aging advocates and the aging network and the disability network. And I know a lot of states, and some of your states may have done this, have started combining those entities, at least at the state level. You look at Texas, they've got a Department of Aging and Disability Services. Virginia went from an office on aging to an office on aging and rehabilitative services. And I think there's many issues that are similar for these folks, for us in the disability community, but there's also a lot of divergence as well. But at least at the state level, I see a trend toward kind of a melding of this work. My New York experience is interesting. I found that the Centers for Independent Living really stepped up to support the program. I mean, I think these are people that know how to do advocacy. They need direction, but they're a very vocal group. They know how to get residents and persons with disabilities out into the community, and they've been very helpful. In New York, when we went from 45 programs and we pulled all the money back and we put it out on a competitive bid, there's now, I think, 15 regional programs. It was interesting to see who bid on those programs because by and large, it was the Centers for Independent Living, the disability community, and those advocates that stepped up and had most of the winning bids. And I think New York's probably left with one or two AAAs that have a local ombudsman program. So I think working with them, trying to find common ground is very helpful in terms of working with the disability community. The only other thing I'll say, Carol, is you had a question about how to prioritize, getting to know folks in the network, and I would suggest building out from your core advocacy network, getting to know, the folks at the State Unit on Aging, getting to know your local programs, getting to know your regulatory agency folks, and then building out from there. Looking if you have memorandums of understanding with various agencies and organizations, kind of taking a look at those, potentially updating them, but those are a good source of information in terms of how you're dealing with other networks and other advocacy groups.
Okay, thank you. Joe, did you have anything more you wanted to say on this topic?
Just that I'm in agreement with Mark about the disability community. Here in California, the California Foundation for Independent Living Centers saw that there were many stakeholders who were working on abuse and neglect issues for older adults and persons with disabilities, but there wasn't really a venue for all of us to come together and talk about what we do and how we can work better together. And so they convened a group, a coalition of older adult programs and disability rights programs, providers, the independent living centers, and they've created this Silence Equals Violence coalition. And it's been really, really helpful. We've discovered resources that we didn't know existed that we've been able to share with our local programs. Getting to know people has certainly improved our working relationship with entities like Disability Rights California. We can call them up when we're dealing with a case for a disabled resident who we're trying to help, and it's been extremely positive. I know some of that history that Mark was referring to about sometimes the discord between the two groups, but this, I have to say, has been a very positive thing here in California, and it's another way again to amplify your message. So I would encourage you to reach out to your independent living centers too, as they could be a good source of support for your work.
And interestingly enough, from my perspective, I didn't know those organizations very well until we came together on the topic of guardianship. And sitting down with them, I was amazed at the resources and the information that they had that I, grabbed at and started using. So thank you guys for bringing that up. So I'm going to open it up now to everyone. Who are the key players in your state? Do you communicate with these people? Who are they? Is there anybody that you feel that you should be communicating with but you haven't? Good stories, bad stories, whatever. So you guys just unmute yourself and talk.
Hi, Carol. This is Bill. Can you hear me now?
Yes.
Okay. Here in Oklahoma, we have what's called the Oklahoma Aging Partnership, and it is a group of other advocates, like Joe was saying. Don't feel like you're out there on your own. We have the Oklahoma Alliance on Aging, the Oklahoma Silver-Haired Legislature, as well as the AARP and some others that I work very closely with, including the Alzheimer's Association. And we're fortunate in the aspect that we come together every Monday during legislative session, and we sit down and talk about the different bills that affect one another's programs and the people who we serve. And we try to all come together and, when we can, support each other in our legislative advocacy. And that is being able to get those voices being heard out there. One area that we here in Oklahoma have had some struggles with has been with our protection and advocacy organization. And recently here in Oklahoma, we're starting to build that relationship better. My umbrella agency has entered into a memorandum of understanding, and I have a meeting coming up with our protection and advocacy organization to hopefully create a memorandum of understanding here in Oklahoma. And we're using the one that you created, Carol, when you were state ombudsman in Missouri, and trying to maybe tailor it to be a little more specific to Oklahoma and how we can participate with each other.
Well, good. There's no reason to reinvent anything. We have a kind of standing joke, don't we, Mark and Joe, that you share from each other. So anything that's developed is, fair game for others. Anybody else want to talk about the key players in their state?
Carol, it's Sally from Michigan. And I think some of the key players that we've identified are, of course, our state survey agency and our Medicaid agency, which we have standing meetings with. But we are also members of the Olmsted Coalition, and that includes a number of different advocacy groups that come together and obviously fight to keep people in the community. And we're working recently to try to help rebalance our budget here in Michigan. But most recently, I think we've developed some really good working relationships with some state legislators regarding a different issue that we had going on here in Michigan. Also with our Attorney General's office, we found them to be very, very helpful. And then with different media outlets, although I don't know that those are necessarily stakeholders, but they can be very key in helping you get messages out if you have good working relationships developed with them in advance.
Absolutely. Good examples. You mentioned the Attorney General's office. Do you work with the Medicaid Fraud Control Unit, the MFUCU group?
That is the group that we made our contacts with and that we have now a very nice working relationship with.
Perfect. Well, that's one. Joe, do you and Mark meet with that group, or at least they know who you are and you know who they are?
Yes, actually, I've got a call with our MFUCU tomorrow. I've been working with Robin Grant at Consumer Voice on trying to get our Attorney General to write a letter that other AGs could sign on to, possibly asking CMS not to repeal the nursing home regulations. And I kind of floated this, to our director of our MFUCU, who forwarded it to the person who does federal policy for the AG, and she bit right away. Within a couple of minutes, I had a email response from her saying, when can we meet to talk about this? So we've got a call tomorrow night to talk about having the AG send this letter, which I think is fantastic. And if he's willing to make it a letter that other AGs could sign on to, that would be, I think, a really good thing that we could do to help preserve these regulations.
Cool. So moving on to building relationships. I just lost my screen. So Joe or Mark, who wants to start talking about building relationships in just a few short sentences?
I'll start because I only have a few little comments here. One is it takes time. It's a labor-intensive process, I think, building these bridges. But you and Joe alluded to something. Oftentimes you can come together with different groups around particular issues. So as an example, right now we're working with the Provider Association and with the Department of Health around the issue of appropriate discharge notices. We did a short study, and what we found, we looked very critically at the notices that we received, and almost 2/3 of them had some sort of defect where there wasn't a date, there wasn't a reason listed for the discharge, or they failed to include the appeal rights and contact information. And so what we're trying to do is work with the Provider Association to do some additional training, us and the Department of Health, with the social workers and lead staff at each of the nursing homes to discuss appropriate discharge planning notices.
That's great, Mark. We're doing the same thing. The Hospital Association actually brought us together to talk about, getting on the same page with regard to these notices. And through this process, we discovered that, as we suspected, the actual practice differs from what's required in the regulations. And it's been a good way for the industry to do a reality check from their members on what's actually happening in the field. And so hopefully, as a result of this work, we're going to be able to address that issue with their help.
That's great.
Great, thank you. So, does anyone have any questions of Mark or Joe? Or any thoughts on any of these topics that you would like to add at this point?
Carol, this is Mark. Can I just add one other thing about just kind of looking at your role and defining what you do and all that?
Sure.
Kind of a quick comment. And maybe because I've done this in a couple places, but I think it's important to remember that the program that you're handed doesn't have to be the program that you operate forever, in terms of what it looks like and the structure and, who's running the program at the local level and all that sort of thing. As you look at your role, one of the things I think you really need to look at is the program as efficient and effective as possible given your current structure. That's not always an easy thing to change, but it can. And I think it's just important to constantly be thinking about that. So just because you've taken over this program that has maybe a certain number of locals or they're in certain entities, it doesn't have to stay that way if you've got a vision, to make it more efficient and more effective.
I would agree with that statement, Mark. I can remember being a very new state ombudsman and not really understanding the role that the state ombudsman should have. And I can remember having many conversations with Sarah Hunt about how do we move this program, how do we get there. And you know, she and I would talk about, you know, moments of opportunity that we can't let go and we can't pass those opportunities up, and that, you know, at the right time and the right place, you know, a window will open and you'll get that opportunity. And that's what happened. That's what happened to me. You know, I finally found a state unit director that got it and understood the role and really advocated for my ability to do my job. So, you know, if you're feeling frustrated, or if you're feeling that you'll never get there, don't give up. You know, continue to push, and, you know, incremental steps can lead to a major change. But Mark's right. You know, the program that you inherit isn't necessarily the program that you'll have forever.
Good, great advice, Mark and Joe, and I thank you for sharing your expertise. I want to remind everybody that it's an opportunity to get together in Denver coming up in April. So if you have not registered, please do so and make your hotel reservations. Our orientation session will be Tuesday morning, following the Monday session with the NASOP meeting, which I encourage all of you to go to Monday afternoon. And if you have not sent in your what's happened in 2017, you know, you don't have to write a book. It's just a couple of paragraphs about something that you would like to share. You can go into, again, the private side of the website and look at, open up any of the conference agendas from previous years, and you will find the what's happening. And in every one of those are wonderful ideas of systems advocacy, training, volunteer management. So be sure and fill that out. We try to have some entry from every state, so don't be the ones that are left out. Again, Mark and Joe, thank you for sharing. And oops, I see somebody wrote a question in. Hang on here. Oh, Susan, let me. Susan, do you want to talk? Susan. Oh, my bad here. I don't know what.
Did you write out the question?
Click to unmute. Click to mute. Oh, I just had her unmuted. There we go. Susan, are you still there? Okay, well, I'm going to get an F for audio. Okay, hey, thank you all again, and look forward to seeing you in Denver. Please feel free to reach out to your mentors, to other state ombudsmen, and to NORC staff if there's anything we can help you with, or if you just need to vent. We will listen with sympathetic and empathetic ears. Again, everybody have a great day, and keep up on the good work. Thank you.
Thanks, Carol.
Thank you, Carol.
Bye-bye, guys.